Good evening, everybody, and welcome to tonight's webinar. My name is Bruce Stevenson, and I have the honor and privilege of chairing a webinar on a fascinating topic with one of the best cat speakers you will ever listen to. I have had the honor of listening to Martha before, and trust me, you are in for a treat. Little bit of housekeeping quickly. We are going to hold all questions over to the end. We may not be able to get to all of them, but we'll do our best to cover as many as we can. But if you do have a question, hover your cursor over the screen, little control bar pops up at the bottom, click on the Q&A box, type your question in there, it'll come through to me, and we'll hold them over to the end. And as I say, we will try and make our way through as many questions as what we possibly can. Our speaker tonight is Martha Cannon. She is an RCVS recognized specialist in feline medicine and co-director of the Oxford Cat Clinic, a first opinion and referral cat-only veterinary clinic in Oxford. Martha combines her active involvement in feline referral medicine with a commitment to providing feline-focused continuing education for veterinary surgeons and nurses. Her lectures focus on providing up-to-date information and practical approaches to diseases that are commonly encountered in day-to-day veterinary practice. Martha is also proud to be involved in promoting the ISFM Cat-Friendly Clinic program, which provides constructive advice on how to reduce the stress that cats suffer when visiting veterinary practices, making veterinary visits easier for the cats, for the owners, as well as for the veterinary professionals who work with them. Martha, welcome to the webinar, Vet, and it's over to you.
Thank you very much, Bruce, and welcome everybody. Thank you for joining us this evening when we're going to focus on an important area of general welfare and care for cats, the aspect of feline vaccination. Now, as Bruce has outlined in that very kind introduction, what I always try to do when I'm talking about cats, whether I'm talking to vets or nurses or as tonight to owners, breeders, lovers of cats, is really try and keep things as practical as I can and as grounded as I can. And what I really want to do is to try and perhaps introduce you to you, or in some cases perhaps remind you about the diseases that we recommend vaccinating your cats against, but actually try and go a little bit deeper than that and perhaps scratch a bit below the surface, maybe tell you a few of the things that aren't often discussed with owners, to look at really the value of the vaccinations, but also we will face up to the fact that they can cause adverse effects, and I know a lot of people worry about those adverse effects, so I'll try and give you as honest an answer as I can to what adverse effects vaccines do cause. And I hope that you will, by the end, agree with me that vaccinations are still on the whole a force for good, but that we do need to use them carefully. And we will look at ways that we can mitigate risks for cats and ways that we can use vaccines to their best potential. Some of what I say actually is a bit controversial, and some of it may not be entirely in line with what you've heard before or what you're familiar with. So let's keep an open mind. As I say, I will try and keep things as practical as I can, but also give you the sort of current and up-to-date thinking. So let's start right from basics really and think about what diseases we need to vaccinate against. Now, there are a wide range of infections that cats can get, and some of them are more common than others. Some of them are more common in different countries of the world. So this is very much a UK perspective because that's where I live and work. And we also know that some infections, unfortunately, we don't yet have vaccines for. Or maybe there are vaccines available, but frankly, they're not very effective. And in this country, in the UK, there are very strict regulations. Any vaccine that's going to come to the market and be available to vets in practice has to meet very stringent requirements in terms of how effective it is, as well as how safe it is. And that can mean that we sometimes don't have quite the range of vaccines available to us in this country that they might in some other countries. But you can trust to the fact that any vaccines that are available in this country have been really road tested and are really proven to be effective. So we do have a number of vaccines available to us, and when we think about vaccines and which ones to use in which cases, we think about what we call the core vaccines, and that's on the left-hand side of your screen here. And those are the vaccines that we would recommend for all cats to have. If we could manage a situation where every cat in the UK was vaccinated against those diseases on the left, that would be our absolute ideal aim. And of course, that's never going to happen, but we do want to try and give as many cats as we can the benefit of vaccinations against cat flu, which obviously is a well-known concept, but perhaps slightly less well-known is that there are actually two viruses that are involved in the syndrome that we call cat flu, and either of them can cause quite severe disease, which I'll come on to in a moment. And then the other core vaccine that every cat in the UK should have the benefit of is vaccination against a virus infection called Feline Panleukopenia. Now, if we look at the right-hand side of this slide, that's what are termed the non-core vaccines, because although they absolutely have a useful role to play, they would not be recommended for every single cat. So these are the ones where we weigh up the individual cat's risk of meeting an infection and decide whether that risk is enough to justify a vaccination. And the top one on that list is the main one that we're also going to talk about today, the Feline Leukaemia Virus vaccination. And that is recommended for any cats that have access to the outdoors and who might therefore, when they're outside, meet an infected cat. And honestly, that in this country is probably going to mean that most cats that have access to the outdoors, we are going to be recommending a vaccination against feline leukemia, which is usually shortened to FELV, being less of a mouthful than feline leukemia virus. Then you can see on the list that it is, of course, possible to vaccinate cats against rabies, but we're very lucky in this country that as yet we don't have rabies in this country. And so we don't recommend giving rabies vaccinations except for cats that are going to travel outside the UK to countries that do have rabies. And that would mean any cats going to Europe, any cats going to America, or parts of the Far and Middle East. So rabies vaccines, not a core vaccine for all cats, only recommended in specific cases. And then likewise, two rather niche vaccines that are really not widely necessary or widely used, but are there for certain circumstances, and that would be against the infection chlamydia, which causes a form of conjunctivitis in cats, or a bacteria actually called Bordetella, which is actually the bug that causes kennel cough in dogs. And it's very rare for that to be a problem for cats, but in some specific circumstances, it may be something that a vaccine is needed. But I don't want to dwell on those vaccines, the rabies, chlamydia, Bordetella, because as I say, they're a little bit niche. What I really want to focus on is the vaccines that all of us who own pet cats need to be aware of and need to be thinking about. And so that's vaccines against cat flu, feline panleukopenia, and feline leukemia virus. So let's think about the diseases first of all, and then we can move on to think about what the vaccines do and the benefits and the advantages and the disadvantages and so on. So cat flu, not surprisingly, cat flu, the most common clinical signs of cat flu are fever and sneezing and nasal discharge. As you see, this poor little kitten in this picture has a very crusty nose, snotty nose, but he also has very sore eyes, watery eyes, sticky discharge around his eyes. And that's the classic signs of cat flu. And I've said to you that there are two viruses that are involved, both Herpesvirus and Calicivirus. And both of those viruses will produce those same signs. So from looking at the cat, you wouldn't necessarily be able to tell which virus they have, but you know it's a very miserable little kitten. And we do know that unfortunately, in particularly young kittens and very elderly cats, the severity of the disease can actually be a life-threatening disease, and they certainly need prompt treatment and help from the vet. And those signs, the classic signs of cat flu, as I say, are shared by both the viruses. There are some other signs that the viruses can cause, which are a bit more specific to the individual virus. And here are some rather horrible pictures of cats with herpes virus infection, which can be particularly aggressive in the eyes. And so you can see the cat at the top there, the ginger and white cat, with really extremely severe conjunctivitis and swelling of the lining of the eye and the eyelids. And this can be so severe that it can even cause the eyelids to fuse together in a permanent way, so that the cat can be left with permanent problems in the eyelids and the lining of the eyes. And the other picture that you see is a cat suffering from an extremely painful condition which herpes can cause, where they get a really big, superficial but very painful, intense ulcer on the surface of the eye, so corneal ulceration, which, as I say, can be very painful and uncomfortable and can be very difficult to treat and to get to go away. So the eye complications of herpes virus can be really quite severe and unpleasant. Calicivirus tends to cause more mild signs in the eyes, but what we sometimes see with Calicivirus, as illustrated by these two pictures, is that it can cause ulcers within the mouth and on the tongue. And again, these can be really intensely painful. They cause the cat to do a lot of dribbling. They very often put the cat off their food because it's just too painful to eat. And that can be a really nasty manifestation of the Calicivirus. So to some extent, the signs that they cause overlap, and to some extent, they also have some more specific signs that might clue us into which one we're dealing with, but both of which will certainly make the cat feel very unhappy. And it doesn't even end there, because unfortunately, even when the acute phase of the virus is through, so just like us, you get flu, you feel really terrible for a while, but then hopefully, if you're well supported and you're not elderly or otherwise vulnerable, hopefully you do recover. But in the case of herpes virus, this picture on the left of this poor little cat with quite a snotty discharge from both nostrils, this is a cat that has had a herpes virus infection which has caused permanent damage to the lining of the nose. And it means that it now can't fight off bacterial infections. So every time we breathe in bacteria. We have normal bacteria that live in our nose and all over our bodies, in fact. But we have normal defenses to protect against them. And in this situation, the herpes virus causes permanent damage that damages that first line of defense and leaves these cats vulnerable to lifelong bacterial infections, which cause this horrible blocked up nose and snottiness, sometimes known as the snuffles, because these cats tend to have permanently noisy breathing and snotty, crusty noses. They also sneeze a lot and spray the snot all over the house and onto the windows and onto the walls and onto the windowsills, and they can be, I'm afraid, really quite challenging to live with. The infection, the snot and the sneezing tends to go away if you give them antibiotics, but as soon as you stop, the signs come back, and it's a permanent damage caused by a herpes virus infection earlier in life. And then on the right-hand side of the slide, we have an illustration of another really unpleasant chronic condition that can develop in cats. And this is an inflammation of the gums called gingivitis. And it often spreads to the whole mouth when it gets called stomatitis. And this is a really nasty, painful condition that cats develop. We don't have a cure for it. One of the things we do to try and help these cats is to remove all of their teeth, but even that doesn't always cure the problem completely, although it usually makes it much more manageable for the cat. Now, we don't know exactly what causes chronic gingivostomatitis. It's a complicated condition, but we do know that Calicivirus certainly plays a role in a lot of these cats. And if they had been prevented from having Calicivirus in the first place, the likelihood is that it would have helped to prevent this disease. So these viruses, as well as causing the obvious signs of cat flu, can also cause really nasty, long-term, unpleasant complications. And those would be the most common manifestations of the flu viruses, but I'm afraid it doesn't even end there. In relatively rare cases, we will actually find that gone too far. We will actually find that the herpes or Calicivirus can actually get into the skin and cause really quite nasty sores on the skin around the face, sometimes around the eyes. And this can actually spread and become really quite widespread around the cat's face and sometimes also on the paws. So that's quite a rare manifestation of the flu viruses, but it is another manifestation that we need to be aware of. However, as I say, that one's quite rare, and much more commonly, what we will see with cat flu is the classic outbreak of snotty nose, sneezing, watery sore eyes, often fever. They're often off their food. And as I said, unfortunately, when it goes through a litter of kittens, if it's severe, it can actually be a potentially fatal problem because of the dehydration and the fact that these poor little creatures don't want to eat. So it's a really unpleasant disease, and unfortunately, it is still an all too common problem. The other thing we need to be aware of with cat flu, though, is that an awful lot of cats who have the cat flu viruses will actually not show any signs of disease at all. And in fact, these cats are what we call healthy carriers of the viruses. So they look to the outside eye completely healthy, and indeed they are completely healthy, but they may well be shedding these viruses in their saliva or in their tears, and they can spread the infection to other cats who might not be so lucky, and those other cats might develop the classic signs of cat flu. So actually the cats that have signs of disease are really only the tip of the iceberg, because there is this population of healthy cats who are carriers of the viruses and the potential reservoir for infection. And that's really problematic when we think about how we can manage these diseases and try and reduce their frequency. So the flu viruses, both herpes and Calicivirus, are highly contagious. The virus is present in saliva and in tears, and also in the nasal secretions. And I hope you might be able to see that the picture on the left-hand side of your screen is a cat that has been caught in the act of sneezing. And you might just be able to see that there are a whole spray of little droplets coming out of this cat's nose. And if this cat has cat flu, when it sneezes, it is spraying virus into the environment, which will land on other cats, which they will then groom off their fur and therefore swallow, and that will lead to a spread of the virus. But the virus, as I say, is also in the tears and in the nasal secretions. So any cats that groom each other and wash each other, that live close together and are co-grooming, can also pick up the virus directly from each other. But it doesn't even end there, because actually if this cat sneezes on you, your hands, your clothes, or onto its food and water bowls, onto a toy, onto a grooming tool or a carrying basket, the viruses, once deposited on those inanimate objects, can actually survive for really quite some time and still be a source of infection to another cat. So if a cat comes through your garden and sneezes on your fence post, or tries to get through the cat flap and smears a bit of saliva or nasal secretion onto the cat flap, and then later your cat comes through and comes into contact with that virus, unfortunately that is also a route for infection. That's more of a problem with Calicivirus than with Herpesvirus, because Herpesvirus has a shorter survival time in the environment outside the cat, but both of them can definitely be spread that way. And again, those healthy carrier cats that do not look as if they have an infection, and cats that even have been vaccinated, can still shed the virus and therefore still spread it to other cats. So to some extent, as I say, the cats that have disease are only the tip of the iceberg. And these are very, very common viruses in the pet cat population all around the world, wherever you look, but certainly in the UK, these are very common infections. So the numbers that I've put on this slide are actually for the frequency of these viruses when you look at healthy cats. So these are the invisible healthy carriers. And you can see that in the case of feline Calicivirus, depending on which study you look at, between 14 and 29% of cats carry these viruses. So that's, roughly speaking, 1 in 5, 1 in 4, or 1 in 5 cats. That's an awful lot of cats. Herpesvirus, you can see the number looks much less, 1 to 8%, but we need to be aware that a lot of cats who carry herpesvirus are not actively shedding the virus at any one time, but they do have the potential to shed the virus at certain times in their life. So again, since the majority of infected cats with herpes would not show on a single swab, we can safely say that that 1 to 8% is only a minority of the healthy carriers of herpes virus. So again, these are very common infections. And unfortunately, what we also know is that those healthy carrier cats are as common now as they have ever been, even though we now have access to really good, effective vaccines, and even though we have been vaccinating cats now for many, many years, we're not reducing the frequency of the viruses within the cat population, which might seem like a very damning statement and might lead you to think, well, in that case, what is the point of vaccinating against them? Well, the answer to that is there is still every point in vaccinating against them, because what vaccination does is it controls disease. So it allows the cat to meet the virus and even be infected with the virus, but not become ill with the virus, or only become very mildly ill, whether if they were not vaccinated, they might become severely ill. So we know that these vaccines, although very good and very effective, they don't prevent the cat from meeting the virus, even becoming infected with the virus, and indeed shedding the virus to other cats. But what they absolutely do is reduce the amount of disease that the viruses cause. So they absolutely do good, but what we have to recognize is what we can expect to achieve by vaccinating against flu viruses. We can expect to achieve reduction in disease, but we cannot expect to eliminate these viruses. So I'm afraid the requirement to vaccinate against cat flu is absolutely there and will continue to be there. So that's a bit about the cat flu viruses. What about the other viruses that we recommend vaccinating against? You may be less familiar with these because actually, fortunately, they're much less common than cat flu. But Feline Panleukopenia, again, is a core vaccine that all cats should have the benefit of. And Feline Panleukopenia is a very nasty infection. It's actually equivalent to the canine, the dog parvovirus. And those of you who perhaps keep dogs or have friends who have dogs will be very aware, I'm sure, of parvovirus, a really nasty, highly contagious cause of very severe bloody diarrhea. And feline panleukopenia is a very similar virus. It's in the very same family. It causes severe dehydration, bloody diarrhea, vomiting, abdominal pain, fever initially, but as the cat gets sicker and sicker, they start to get low body temperature, and that makes them even sicker. And that's a very worrying sign when the body temperature starts to drop. They will get some anemia. They will also have a very profound loss of white blood cells, which leaves them vulnerable to all other infections. And I'm afraid it very often is a fatal disease, despite best attempts at treatment, and especially in young kittens. Now, fortunately, this disease is now quite rare in the UK. It's common in other countries, but it is rare in the UK, and that is largely due to the success of vaccination, because vaccination is very effective in this disease, and the more cats we vaccinate, the less common the disease becomes. But we do still see it. It does still cause outbreaks of disease, often in environments where there are a lot of cats coming and going and a lot of kittens, so particularly in rescue centres. And we also need to be aware that, unfortunately, the canine parvovirus is similar enough to the feline panleukopenia virus that it can actually infect cats, and it can cause the same signs, the bloody diarrhea, the dehydration, and so on. And luckily, the virus, the vaccine protects against the canine parvovirus infection as well as the feline panleukopenia. And just like the flu viruses we talked about, these viruses can be spread via inanimate objects. And I think it's probably well known that with dogs and puppies and parvovirus, even if you're walking along the pavement, you tread where an infected dog has pooped in the past, you can pick up the virus on your shoe and carry it into your home. So it's quite a scary thought. It is rare in cats to see disease, but it absolutely is a disease that we should be vaccinating against, because it is so completely preventable. Because vaccination against panleukopenia is incredibly effective. These are fantastic vaccines. They produce very, very strong and solid immunity, which prevents infection and spreading of the virus, as well as preventing disease. So that's different to what we talked about with the cat flu viruses. And the best news of all is that the immunity lasts for a really long time. It lasts for at least 6 years, and probably, to be honest, it lasts lifelong. So vaccination against feline panleukopenia is incredibly effective, and we absolutely should be using it. And then the third disease category that we recommend for a lot of cats in the UK is vaccination against the Feline Leukemia Virus, the FELV virus. Now, Feline Leukemia Virus is possibly a bit badly named, because although it can cause leukemia, it actually hardly ever does. It's quite a difficult one to explain what it does, because it can do so many different things, and the signs that the cat shows can really not sometimes give you not really a strong clue that that is what's wrong with the cat. So they just feel quiet and lethargic. They may have fever. Some of them will develop anemia. It can lead to certain types of cancer, like lymphosarcoma. Some cats will get very sore gums and gingivitis. So a wide range of different signs. I can't really give you a classic appearance of a cat with feline leukemia, and that's why vets will very often end up testing cats for FELV when they present with a wide range of different signs and symptoms. Now, the bad news is with feline leukemia, as you can see on this slide, it's a very aggressive disease. And once a cat really succumbs to feline leukemia, whatever the manifestations are, it tends to gradually get worse over time. And the very sad news is that most cats that have this infection will die from the infection within a couple of years. So it's a really nasty infection. Again, happily, it is now a rare infection in most of mainland UK. And again, that is largely due to the success of vaccination, which again has a really powerful effect and is a really strong vaccine. And it is also testament to, in the early days when the disease was first discovered, to pedigree breeders who really took the bull by the horns and decided that they did not want this virus in their pedigree cats, and so they had a rigorous program of testing cats, and sadly, if they were found positive, those cats were euphemistically removed from the breeding pool. I'm afraid what that means is most of those cats were put to sleep, euthanized. But given that they would have died from their disease within a couple of years, that was actually probably the best thing for those cats as well. So it is unfortunately still very common in some other countries, and anyone who is ever tempted to rescue a little cat from Greece or Ireland or the Middle East or the Far East or Thailand or wherever you are on holiday, please be aware that this is a very common problem in some of those countries, and you should make sure those cats are tested before they come into this country. Otherwise you are bringing a whole heap of heartache upon yourself. And unfortunately, that infection is still present in some feral colonies and stray cat colonies within the UK. So again, although it's a rare virus, it is absolutely still a virus that for any cats that have access to the outdoors and might meet this virus, they should be protected from it. But this virus does not spread on shoes and inanimate objects. It is only spread by direct contact with infected cats. And so cats that live only indoors and do not meet other unknown cats are not at risk from this particular virus. Again, when we do vaccinate, the vaccine is very effective. It produces solid, long-lasting immunity that prevents infection as well as disease, and so it's had a huge impact in making feline leukemia a rare condition. But again, that doesn't mean that we should relax and not vaccinate against it, because it is still out there, and the last thing we want is for it to start to get more common again. So that's just a very quick whistle-stop tour of the infections and the kinds of damage that they do. Let's turn our attention now to the more positive aspect and think about vaccination decisions for cats. And it might perhaps surprise you to hear that I spend a lot of my time actually talking to vets and to vet nurses about feline vaccination and feline vaccination protocols, because actually it's not just as straightforward as saying, yep, they should all have vaccines and that's that and that's the end of it. These days life is more complicated than that, and vets, when they think about cats and vaccines, have a number of things they need to think about. Not just which diseases is the cat at risk from and should be vaccinated against, which is obviously what we've just discussed, but which particular vaccine brand should they use, because they aren't all the same. How often should they vaccinate, and how often should cats get boosters? That's really quite a controversial topic, which I will touch on. And for cats that have perhaps missed a booster or just are a bit late getting their booster, do we need to start the course again, or can we just give a single injection to get the cat back on track? And these are things that we talk about as vets amongst ourselves, and we try to encourage vets to think a little bit outside the box on this, and it's an area that I will touch on with you guys tonight. So traditionally, in the good old days, when life was simple, all cats came in and they had their annual jab, and it contained all the different vaccines that you could vaccinate against, and every cat was given every agent every year into the scruff of the neck, and that was what was recommended. And if you slipped up a little bit, and as an owner you were a little bit late presenting your cat for a booster, and it perhaps was a month or so overdue, no problem at all, but what we needed to do was give 2 vaccines 3 weeks apart, restart the course just as if they were a kitten, and get you back on track. And that was in the good old days when, as you see from this picture, vets were benign elderly gentlemen with white hair and glasses, and everybody loved them. Life was simple in those days. The advantages of this approach, well, it's quite straightforward. Everyone can understand it. Everyone can remember when the cat's vaccines are due. Everyone knows what they're doing. The cats come in each year, and it means they have an annual health check, which is very, very important. It means that we're absolutely following the manufacturer's guidelines, and from a legal point of view, everyone feels safe and covered. And it absolutely ensures that every cat has maximum protection that can be achieved by a vaccine, which, by the by, keeps cattery owners happy, because, as you know, if cats are going to boarding catteries, they must be vaccinated against cat flu and feline panleukopenia. So there were some advantages to that approach, but then of course life gets more complicated, doesn't it? We start to understand more, we start to get better educated, and owners started to say, well, hang on, does every cat actually need every agent every year? And to be honest with you, some vets started to wonder, does every cat need every agent every year? And then unfortunately things started to change, and people started to think that vets perhaps weren't quite the cheery, avuncular, animal-loving people that actually we are. And they started to think, well, hang on, is this vet just trying to make money out of me? Are they getting me in for this annual jab just so that they can take more money out of my pocket? And it all started to get a little bit, the relationship started to break down a little bit. So can we over-vaccinate? Actually, how long do these vaccines last, and how often do they need to be given? It's an important consideration. It's not an easy question to answer, but it is an important consideration. And should we worry about adverse effects of vaccination? That's obviously a very contentious subject in human medicine and also in dog medicine and cat medicine, because there are some adverse effects, and how much should we worry about them? And to what extent does the worry about adverse effects stack up against the potential benefits of vaccination? So all of these questions start to be asked by owners, but actually also by vets, and it starts to make the whole situation rather more complex. So in this day and age, we have more vaccines available to us, so there are more diseases that we could vaccinate against, but do we need to? There are a wider range of vaccines available. So as a vet, we have to decide which one are we going to buy, which one are we going to use. And of course, all the different manufacturers will tell us that theirs is the best one. And we need to pick our way through that and try and work out what truly is best. And part of that range of vaccines is because there have been huge developments in vaccine technology, and we have much better vaccines available to us. So all of this is leading to a more complex situation, but we do also now have a much better understanding of how vaccines work, how effective they are, and actually how long they last. So the genuine concerns about adverse effects we take on board, and we start to look at trying to develop a more coherent approach to cat vaccination, rather than trying to apply that every agent to every cat every year, which is sometimes called the one-size-fits-all approach. And we're very much moving away from that approach these days. One of the problems that vets have, though, is that in all forms of medication, we rely on the manufacturers to have what they call a license for their product. And that means that the product has been tested for both effect and for safety, and the types of side effects that you might see have been well established, and the way that you should use it and the dose that you should use and the frequency with which you should give it has all been clearly established. And if you follow the data sheet and you go by the licensed approach, you are on usually safe ground. The problem we have with vaccines, though, is that for whatever reason, in order to get a license, a manufacturer only has to show that their vaccine lasts for the minimum interval that they recommend on their data sheet. And as you're probably aware, traditionally that has been a duration of 1 year. The problem is that there has never been a requirement of manufacturers to test beyond that and to see if their vaccine actually lasts significantly longer than 1 year. And since they don't have to do it, and since these tests are very expensive, most manufacturers have not done that extended testing. So they tell us to use their vaccine every year because they can guarantee that it will last for a year. But what we don't know in some cases, or what we did not used to know, is how much longer than a year it might last. And that's really what led to the recommendation to have an annual top-up. So as a vet, we have a dilemma on our hands. Do we follow the data sheet, which is, after all, what the legal situation dictates? But if we do that, we may end up giving more vaccines than are strictly necessary. Or do we go off license? Do we go off piste? Do we do our own thing? And do we say, well, I think we probably don't need to give it every year? Well, the risk there, of course, is that you may leave the cat vulnerable to an infection that you could have prevented. And as a vet, trust me, that is our main aim in life, is to avoid that situation. So we really don't want to risk a cat getting ill that we could have protected. The other side of it, and vets do worry about this, is that if the cat were to get an infection that the vaccine should have prevented, will the vet get sued by the owner for that infection? And vets probably worry more about that than they necessarily need to, but people do worry, and we do know that we live in a more litigious scenario community. So if we follow the data sheet, we're protected because we've done what it says on the tin. So happily, there is help for vets in this scenario, and indeed help for owners who want to try and avoid the one-size-fits-all approach. And we now have a number of independent guidelines that are based on independent evidence that are recent and up to date. Usually there is one that is locally relevant to the situation that pertains in your own country. And these give good practical advice as to whether we can stray away from the data sheet recommendations and actually still follow good evidence-based medicine, but perhaps not rigidly apply that one-size-fits-all approach. And although there are a number of different guidelines out there, they do share a significant they share a significant overall and overarching ambition, which is that we should try to vaccinate more individual cats, but vaccinate each individual cat less often. So yes, we want to still vaccinate, and yes, we want to give as many cats as we can the benefit, but we do want to weigh up for each individual cat just exactly which vaccines they need and how often we need to give them. So how often should we vaccinate? If we don't give enough vaccine, if we don't vaccinate frequently enough, there is a risk of an individual animal suffering disease and of spreading it to other cats as well. And so it goes wider than just the individual animal, because there is this concept of population immunity. The more cats that are vaccinated, the less of the virus is being shed and the less chance that unvaccinated cats can get that infection. So there is an actual advantage to the whole population if enough animals are vaccinated. But the other side of that coin is that if we give too many vaccines, if we over-vaccinate, there is of course a financial cost to you, the owner, of having the vaccines, and that's not something that we want to avoid or ignore. And there is also the increased likelihood that we might get an adverse reaction. Now, adverse reactions to vaccines are rare, and they are usually mild and short-term. And those, even amongst these rare reactions, those are the most common. But we do know that occasionally we can get a severe and life-threatening reaction. Again, very, very rare, but it can happen, and when it does happen, it's devastating. So we do, of course, want to avoid that. So just touching on the financial cost, I think that these days, hopefully, annual vaccinations are affordable for really the vast majority of cat owners, particularly because here in the UK, most veterinary practices now have pet health plans, which give you discount off your routine healthcare and also allow you to spread the cost in a monthly payment. So that really helps to keep your costs down and spread them out. Or some practices, some of the corporates offer what they call a for life scheme, where you pay a one-off fee and that covers your vaccines for the rest of your pet's life. And those are heavily subsidized incentive schemes. So usually vaccination is now much more affordable than it used to be. And the other side of the financial cost that we need to bear in mind is that even if your cat does not need a vaccine this year, it is still strongly recommended that every pet cat should have an annual health check. And indeed, kittens and elderly cats, because they are so much more vulnerable to disease, a 6-monthly health check is strongly recommended as gold standard owner's care. So the financial cost is there in terms of the annual health check, whether or not the cat needs a vaccination. So why do we recommend routine health checks? They are important throughout life. It is really important that you don't wait until you can see that your cat is sick. We do strongly recommend an annual, or as I say, a 6-monthly health check. It allows your vet to identify disease while they're still reversible and more easy to manage. And it allows your vet to know what is normal for your cat, to get to know what weight is normal, what heart rate is normal, what the cat looks like when it's well. And why is that important? Well, it's because we know that cats are masters of disguise. They are very good at hiding from their owners and even from their vets that they are unwell until things are really quite advanced. So anything we can do to pick up disease early is going to give us a much, much better chance of helping that cat out and helping to manage some of the very common but reversible conditions that our pet cats can run into. So back to vaccines, that was just a little tiny aside, but back to vaccines, as we've said, adverse reactions are rare, and we can universally say that the benefits of vaccination outweigh the risks of these adverse events, but they do happen and we should be aware of them. So in the UK, we have a system called the Suspected Adverse Reaction Surveillance Scheme, in which vets report any adverse effects that they see. And from that scheme, we can see that on average, there are about 6 adverse reactions to vaccines for every 100,000 vaccines sold. That is a tiny, tiny amount. It is, of course, still something to be aware of, but it is a tiny amount. But this does rely on owners telling vets that there has been an adverse reaction, and vets then telling the Veterinary Medicines Directorate. So maybe it misses some, and maybe the rate of adverse reactions is a bit higher than that. In the US, they have a slightly different surveillance scheme, which is automated. And so it picks up every single adverse reaction that a vet might come across. Even so, and even in a country where they have a wider range of vaccines and a legal requirement to vaccinate against rabies, so again, a much higher rate of vaccination, only 516 adverse reactions per 100,000 vaccines given. Again, a tiny rate, and the true situation in the UK is going to be somewhere between the 6 and the 516, but it is still very, very low. So please don't run scared of adverse reactions, because even when they occur, the vast majority of them are mild and transient, and the cat gets better on its own. So it's relatively common for young kittens to be a little bit off their food for a day after a vaccine, but it's usually very mild. Sometimes cats get an itchy skin at the site of vaccination, but it is incredibly rare for them to get a serious allergic, life-threatening allergic reaction. I don't think I've actually ever seen that in a cat. I've occasionally seen it in dogs in my younger days when I treated dogs, but I've never seen it in a cat. People worry about other immune-mediated diseases like anemia or polyneuropathy. There is some suggestion that that can rarely happen in people after a vaccine. Suffice to say, there is nothing to suggest that vaccines in cats cause those longer-term immune-mediated problems. Feline injection site sarcoma, however, is a serious problem that we do worry about. And I'm sorry, there should be a picture at the top of this, and for some reason it's not showing on my screen just now. So you are spared the rather unpleasant picture of a cat with a really nasty injection site cancer. They are rare, but we know that they do happen. In the UK, the estimated incidence is about 1 for every 5 to 10,000 vaccines given. So again, very rare, 1 to 5,000 or 1 to 10,000 vaccines. But they are a serious problem if they do occur. We do need to be on the lookout for them. And again, I just wanted to spend a moment or two talking about feline injection site sarcomas so that you know what to look for. Now, vaccines are the most common cause of these, but other injections can be implicated. So anything that is injected under the skin of a cat, whether it is antibiotic or corticosteroid or whatever, could potentially cause one of these injection site sarcomas, but vaccines are the most common, and particularly vaccines that contain an adjuvant, which is an agent put in the vaccine to cause inflammation to improve the immune response. So it seems to be that that inflammation is what triggers the cancer to start to form. Again, very rare, but what should you watch for and when should you worry if this might be happening to your cat? So the first and obvious thing is to keep a close eye on any injection site. So anytime your cat needs to have an injection, keep an eye on the site, have a feel of that area when you're stroking your cat. And consult your vet if there's any skin reaction at the site of an injection within the first few days after the injection's been given, or if a lump forms at the site of the injection in the weeks and months following the injection. So you do need to just keep a bit of an eye, and it's normal when you're stroking your cat. These things are right on the surface, so you will feel them as a little firm lump if they are forming. And as vets, we know that the earlier we get onto these things, the better the chance of treating them. And so vets apply what we call the 3-2-1 rule. And that is to investigate by biopsying any swelling at an injection site that is present for 3 months or longer, grows to 2 centimeters in size, or is still growing 1 month after the injection was given. So that's the 3-2-1 that your vet will rule that your vet will apply. And if you're aware of that, it can help you to put in perspective whether you need to be concerned about a lump at a vaccine site. And indeed, it goes a bit further than that, because what we also recommend to vets is that, given that this can occur, it's incredibly rare, but it can occur, and surgery is needed, it makes sense to give vaccines at a site where surgery can more easily be done. So these days we try to avoid giving vaccines into the scruff of the neck, the traditional place, because it's too near the neck and the vital structures of the head and neck. So we tend now to recommend injecting down the leg or over the flank in sites where it is easier to remove a tumour in the very rare event that it should happen. And I don't want to scare you with all of this, but knowledge is power. And if you're aware of these things, then hopefully we can put the problems into perspective. Because again, these adverse events are rare, but the adverse effects of the infectious diseases that we are vaccinating against are common and really nasty and unpleasant, and can indeed be fatal. So again, I want to put that in perspective and say that we absolutely do and should be vaccinating as many individual cats as we can. But again, in order to help reduce the chance of an adverse reaction, let's vaccinate each individual cat less often, often enough to keep it safe, but not more often than we need. And that's really the mantra about feline vaccination these days. So moving on briefly to things which actually your vets need to consider, but I'm afraid to largely maybe out of your hands. What type of vaccine are we going to use? And without boring you too much at this time of night, vaccines come in broadly 2 categories. They come in what we call the infectious category, and in this case the vaccine contains a small amount of a safe form of the virus, which once injected will multiply up within the body and spread through the body just like a real virus. It's a safe form of the virus, but it's a real virus. So it stimulates a rapid, strong immune response, just in the same way that the actual infection would do. The other type of vaccine that is sometimes used is what's called a non-infectious or a killed vaccine. And in this case, the vaccine contains a small amount of the virus, but the virus has literally been killed off. So it does stimulate an immune reaction at the site it's been given, but it cannot multiply within the body. That used to be considered an advantage, because if it can't multiply within the body, it can't cause disease. But actually, what that means is it also doesn't stimulate anything like a full immune response. So other chemicals, and this is where these adjuvants that I touched on before come in. These adjuvants are added to the vaccine to cause inflammation, and then the inflammation kickstarts a better immune response to the vaccine virus. Now, it's relatively late in the evening and you might be thinking, oh, crikey, she's lost me now. This is all getting a bit technical. Please don't worry about it. I really just want to make the point that we have infectious viruses which are more effective at inducing immunity. A single injection induces immunity as long as there's no colostrum antibody still present in young kittens. But they do contain live viruses that multiply and are shed and are spread just like real viruses. So there used to be a worry that this might lead to the viruses getting more active and actually starting to cause disease again. So the potential to cause mild signs of disease, and that used to lead people to feel that they weren't such a good thing. Suffice to say, with modern vaccines, any disease signs are incredibly mild, and it's really very, very rare to run into this as a problem. So vaccine technology has improved. The viruses are much safer within the vaccines, and it's much less of a problem. On the other hand, we have the killed viruses, which I'll remind you, they contain virus which is unable to infect or replicate the cat, which you might consider to be a good thing. But unfortunately, with these, we need to give several doses in quick succession to get the immune response. The duration of immunity is generally shorter, and we need to put these adjuvants in order to get the effect. And unfortunately, those adjuvants have been highlighted as a potential cause of injection site sarcoma, which is a bit controversial, but suffice to say that the World Small Animal Veterinary Association vaccine guidelines recommend that in cats we should use non-adjuvanted vaccines wherever possible. So that's a little bit of background about vaccine types, and I just want to touch now on the current independent World Small Animal Veterinary Association vaccine guidelines and let you know what they recommend in terms of frequency of vaccination. Now, these WSAVA guidelines, if you're really interested, are available free to access online. You don't have to be a vet to access them. They are incredibly detailed. They provide a wealth of information about both cats and dogs, but it is quite a lengthy document, and trust me, it is not necessarily in parts the most mind-grabbing, attention-grabbing read that you will ever have had, although parts of it are very well written. But if you really are interested in this subject, that would be a good place to go. So what do the WSAVA guidelines recommend? Flu vaccines, as we've said, are a core vaccine that every cat in the country should get the benefit of. They need a kitten course to establish immunity. They need a first booster, which is usually given 1 year later. But then with the flu vaccines after that, for cats in low-risk environments, the recommendation is to use a modified live vaccine, so one of these live virus vaccines we just talked about, and to only give a booster every 3 years. If we're using a killed vaccines do not last as long. The immunity they produce does not last as long. So if your vet is using a killed vaccine, the booster will need to be done every year. For the live vaccines, some manufacturers do now have a 3-year license. So some of them we can still follow the manufacturer's recommendation and still also follow the WSAVA guidelines. But there's a really important word in this, and that's cats in low risk environments. What do we mean by low risk? We mean cats that live on their own with no other cats, indoors only, so they won't be coming into contact with the secretions and the viruses from other cats, cats that don't visit boarding catteries, and I would extend that and argue cats that don't have to frequently visit vets for health checks or because they have other conditions or diseases. Because unfortunately, within the veterinary practice, obviously there will be cats coming through who have not been vaccinated or are healthy carriers and shedding the viruses. So a 3-year vaccine, if it's modified live and the cat is in low risk environment, but an annual vaccine if you're using a killed vaccine, or if the cat has access to the outdoors, or is not the only cat in the household, or it does visit boarding catteries. So that would be the recommendation for flu viruses, for flu virus vaccines. If a cat has so-called, it has lapsed, and by lapsed we mean that they have had vaccines in the past, but they have not had a vaccine, a booster in the last 3 years. If we use a modified live vaccine, we can give a single injection, and that will bring the immunity right back up and get the cat back on track. So we do not need to restart the course if the cat has had any vaccination in the last 3 years. And again, that unfortunately is against the vaccine manufacturer's data sheet, which still states 2 injections 2 to 4 weeks apart. But with a modified live vaccine, a single injection will do the job. If we're faced with an adult that we don't know whether it's had vaccines before, or it is an unvaccinated adult, perhaps you've adopted it from a rescue center, or you know, for whatever reason it has not yet been vaccinated, then again we do need to start the course from scratch and give 2 injections 2 to 4 weeks apart. Although actually with a modified live vaccine, the likelihood is they will still get significant benefit even if they only get a single injection. So if you are perhaps in a situation where till now you have not had your adult cats vaccinated, I'd really encourage you to think about getting it done. And if you really feel that 2 visits to the vet is just too much for you to cope with, even a single injection, if it's a live virus vaccine, will provide benefit. And then we need to be aware that the best cover, the most strong immunity, will be in the few months after the vaccine is given. And so if your cat does go to a boarding cattery where they are at risk of meeting these viruses, we would recommend that you time the annual booster so that the cat gets that booster within the 3 months before their stay at the cattery, and that will give your cat the best possible protection. So briefly moving on to the other vaccines, Feline Panleukopenia vaccine, we said, is a really good, really strong, really long-lasting vaccine. It's a core vaccine that is recommended for all cats. They need their kitten course. They need their first booster, again, usually done at 1 year. But then after that, we do not need to give that vaccine more often than every 3 years, and that's in the WSAVA guidelines. Some manufacturers do have a 3-year license. Unfortunately, some do not. But even those that do not have a 3-year license, 3 years is still absolutely fine, even though it's off license. Unfortunately, a lot of manufacturers also put the panleukopenia in the same vial as the flu vaccine, so they have to be given together. Therefore, if your cat is having an annual flu vaccine and the vet is using one of those products, it will get panleukopenia every year, whether it needs it or not. And that's an unfortunate situation from the way vaccines are manufactured. But there are vaccine companies and vaccine manufacturers who do make separate flu-only vaccines so that you can distinguish. Again, if the cat has lapsed and it has not had a vaccination for more than 3 years, or it's an unvaccinated adult, in the case of panleukopenia, this fantastically effective vaccine, a single vaccine is all that's needed to give full immunity. They do not need the 2 injections that the kittens need, even though the vaccine manufacturers in their data sheets usually suggest that you do need to give those 2 injections. So I know this is all a bit confusing, but I wanted you to sort of know where vets are coming from, where the independent guidelines are coming from, and areas in which we might be able to cut back a bit on the number of vaccines cats get. So finally, just briefly, the FELV vaccines, again, current World Small Animal Veterinary Association guidelines. It's a core vaccine for cats that have access to the outdoors, especially the youngsters under a year old, because they are the most vulnerable to picking up FELV infection. So they should have a kitten course. They should have a first booster at 1 year. And then after that, again, they only need a booster every 2, or actually we recommend every 3 years after that, if they are still seen to be at risk of infection because they still go outside and they still potentially meet foreign other cats who might be infected. One of the vaccine manufacturers does now have a 3-year license for their FELV vaccine, which is great. The others do not. But it is still the case that even if the manufacturer data sheet says once every year, it is absolutely fine for it only to be given every 2, or even we would advocate every 3 years. So again, these are ways in which we can try to reduce the number of vaccines that a cat is getting, but we would still strongly advocate that annual health check. Whether the cat needs a vaccination or not, the health check is a different thing and has huge benefits. It allows us to pick up early if the cat is gaining weight and getting a bit fat, because it's much easier to deal with that in the early stages rather than when the cat has really got a weight problem. It allows us to do a dental health check and check for tooth problems, which are unfortunately incredibly common in cats as they get a bit older. And actually an annual dental check is a requirement for many insurance policies. If they cover dental work at all, they will require that the cat has an annual dental check because these problems are so common. And we can pick up other common, manageable problems that otherwise might easily go undetected, and we can therefore improve the health and well-being of the pet cats in the UK. And again, a 6-monthly health check would be recommended for kittens and also for older cats as they get more vulnerable to disease in older age. So what about those older cats? Do they still need to be vaccinated? What are the considerations for an older cat? We do sometimes hear of people who believe that as they get older, they don't need to continue with their vaccinations, almost as if the fact that they've had a number of vaccines in the past sort of builds up and protects them. And I'm afraid that just isn't true. In fact, it's quite the opposite. We're familiar with the idea in humans that the flu vaccines that are available are recommended for elderly people, but not so much for young, fit people. And that's because your immune system gets less effective in older age, but also because actually in older age, if you do get flu, it is going to hit you much harder and be potentially much more serious. And the same applies to cats. Cat flu can be a fatal infection in elderly cats, whereas a young 4 or 5-year-old cat is more likely to throw it off. So actually, with flu vaccines, we should continue to vaccinate into old age. And actually in cats that have had boosters only every 3 years in their youth, because they were in that low risk category, we should actually consider giving them an annual booster once they're into older age, because again, their immune system is less likely to remember the vaccine for such long periods of time. So a top-up is a good idea. And in terms of adverse effects, to be honest, if the cat was going to get adverse effects of the vaccine, by the time it's in old age, it probably would have done it by now if it was going to do it. On the other hand, though, what about the requirement in old cats for FELV vaccination? Bearing in mind that this is really only recommended for cats who go outside. An elderly cat may not be going outside nearly as much and may not be roaming as far. And again, FELV is not spread on fence posts and clothes and patios and flower pots and whatnot. It is only spread by direct contact with the infected cat. And most elderly cats perhaps are not out and about as much and not meeting those outdoor cats as much. They keep themselves to themselves, they keep themselves safe. So actually your older cat may no longer need vaccination against FELV, and by dropping that from the equation, you may be able to vaccinate your cat less often. So again, we vaccinate more individual cats, but we vaccinate each individual cat less often. Okay, so we've covered a lot of ground. I hope you've found it useful. I hope you found it interesting. I hope you're still with me. I just wanted to reiterate really some of the take-home messages, because I know we have covered a lot of ground here. So the cat flu viruses, we showed what horrible diseases they cause. We've said they're very common, they're very contagious, and they do cause very nasty disease. And unfortunately, even with vaccinations, the vaccinations have an enormous role to play in reducing disease and suffering, but they will not and cannot eliminate these viruses from the population. And especially because of the healthy carrier cats, these viruses will remain common and will remain with us. And we must stay vigilant and we must continue to vaccinate. Adverse effects of vaccination are rare. We talked about the adverse effects, but we need to remember that these vaccines are very good and in the most part very safe. But nevertheless, we do need to be aware of the adverse effects and what we can do to mitigate and reduce the chances of causing an adverse effect. And so if we choose to use the modified live and vector vaccines, we know that they will provide stronger and longer immunity than the killed vaccines, and they don't contain adjuvants, which many people would argue should also reduce the risk of causing an injection site sarcoma. Although again, that is contentious, and others would argue that any vaccine can cause an injection site sarcoma and that it's fine to use adjuvanted products. The bottom line is, keep an eye on any injection site. Anytime your cat has an injection, keep an eye on the site, have a little feel of the site, and always, always get any lump that comes up at an injection site checked by your vet. Vaccination choices, we talked about tailoring the plan to the individual cat rather than applying that rather old-fashioned one-size-fits-all, every agent, every cat, every year approach. So we try to be more nuanced, and we try to be a bit more clever with our vaccination protocols. The vaccine manufacturers, unfortunately, don't always help us in this, in that the data sheets only tend to indicate the minimum duration of effect. But I'm not here to knock vaccine manufacturers. They do a great job and they produce fantastic vaccines at really what, given the technology that goes into them, are incredibly affordable prices. It is massively expensive for a vaccine manufacturer to run the kind of clinical trials that would be needed to get an extended duration license. So huge kudos to those companies that have done it and now do have extended duration licenses. Fantastic that they have done it, but it is understandable that not all of the companies have yet done that because of the enormous cost, millions and millions and millions of pounds to do these big trials over many, many years. But we do have the independent guidelines that we can use. We don't need to slavishly apply the data sheet recommendations. We do have this reliable source of advice to allow us to sensibly weigh up the risks and benefits for an individual cat, and we can go off license. But we need your permission to do it. We need you to agree and to give us the informed consent to do it, and many vets will be discussing these factors with you. Briefly then, again, take-home messages. Feline leukemia and panleukopenia, once vaccine immunity has been established, the boosters are only required every 3 years. But with cat flu, once the vaccine immunity is established, if the cat is at low risk of infection and a live virus vaccine is being used, then every 3 years is fine. But in all other circumstances, an annual vaccine is still recommended. And that really does encompass the majority of cats who live with another cat, go to boarding catteries, have access to the outdoors. And again, it applies to all cats who are having a killed vaccine against cat flu, because again, the killed vaccines have a shorter duration of effect. Another really important take-home message, and it's actually my last slide, because if you honestly remember nothing else, please remember this: an annual health check is really important for your cat's welfare, whether or not you have them vaccinated, whether or not they are due a vaccination that year. The early detection of problems that are common and manageable will really help to keep your cat fit and well for longer. And again, a 6-monthly health check is recommended for little kittens, and for older cats, usually cats over about 10 or 11 years old, we will start to recommend a 6-monthly health check. Okay. Thank you very much for your attention. As I say, I hope it's been helpful. I hope it's been interesting. I know I've overrun a little bit. I apologize for that, but I am happy to take any questions that might be out there.
Well, folks, I promised you an amazing webinar with great information from a fantastic speaker. And Martha, thank you so much. You never let me down. You never turned me into a liar.
Oh, Bruce, you're making me blush, but thank you very much. You're very kind.
That was absolutely fascinating. It really was. So thank you, Martha, and we will definitely have you back. Just another big thank you as well to our sponsors, Feline Friends Academy, who made tonight's webinar available to everybody. Thank you, Feline Friends Academy, for bringing this through to us. Folks, just before we start moving on to questions, I just want to say we've had loads and loads of questions about my cat has and should I be and whatever. Unfortunately, we cannot go into all of those. I don't personally believe that we need to go into them because Martha has given us the most comprehensive insight into it. And for all of those of you that wanted to discuss your personal cat's vaccines, my advice is go and talk to your vet. And if they have any questions, Martha is absolutely fantastic with dealing with vets one-on-one and discussing things. So really, we cannot touch on those. We have too many questions and we have already run over. So Martha, we're just going to have a couple of little questions.
Sure.
A good one that came through, Greg asked, when you were talking about the canine parvovirus affecting cats, he asked, can feline panleukopenia virus affect dogs?
Oh, blimey, that's a really good question. My guess is that yes, it can, but it is a guess, I'm afraid. I'm not a dog vet, and it's a very, very long time since I have laid hands on a dog in a veterinary clinic. My guess, though, is that the two viruses are sufficiently similar that it could go the other way, but also that the canine parvovirus vaccine would protect against the feline panleukopenia in just the same way that the feline panleukopenia can protect against the canine parvo. But what a great question. Thank you for that one. That's great.
I'm going to paraphrase and try and dump a whole lot of others together. We've got a lot of breeding questions and everything else.
Yeah.
The first part of it is, in a breeding situation, if you get a whole litter of kittens that show flu-like symptoms after being vaccinated, specifically with a killed vaccine, should we be worrying about things like feline coronavirus and other viruses playing a role rather than vaccine reactions?
I would say that you certainly don't need to worry about coronaviruses. It's a very hot topic at the moment because of the outbreaks of Middle Eastern respiratory syndrome, a systemic inflammatory response, and indeed at the moment this awful outbreak that's going on in China, that is a coronavirus, and in humans it does cause respiratory disease, but it does not do that in cats. In cats it can cause the hideous disease of FIP. That's a whole different topic for a whole nother webinar, but it does not cause respiratory disease. There are some other things that can cause problems on the eyes, and chlamydia was a vaccine I touched on at the very beginning but we did not talk about. So if it's conjunctivitis, chlamydia would be a problem. Even bordetella can cause respiratory signs. But generally, if the whole litter is affected, I have to say I don't know that I've ever come across a situation in which the vaccine has caused a problem in the entire litter. So I think in that circumstance, I'm afraid the most likely thing would be that the kittens had already been exposed to one of these viruses because they are so common, and they were already incubating the infection when they were given the vaccine. And of course, we're all human and we all make a direct link between cause and effect. But the way that a live vaccine most likely could cause very mild disease is actually, bizarrely, if the cat licks it and takes it in through its mouth. And the way that can happen is if accidentally the virus gets squirted into the atmosphere and the cat breathes it in, or if the vet accidentally spills a bit of vaccine on the cat's coat when giving the injection and the cat then licks it off. But it causes incredibly mild signs if that happens. You really don't need to panic about it, and it would not affect the entire litter. So if you really do have a problem with the entire litter developing signs, then I'm afraid it's more likely that they already had the virus, possibly the stress of being taken out of the home and put in the car and taken to the vets could help to bring out the signs, but I think it would be the case that they had the infection already before they turned up to have the vaccine, and unfortunately the vaccine probably gets blamed. In that circumstance, and I'm sorry, I'm giving you a very long answer to this question, but you know, it is a really important area. In that circumstance, it is possible in some specialized labs to take swabs from the cats and actually identify the exact genome of the Calicivirus that's caused the problem and compare it to the Calicivirus in the vaccine to show whether it actually is the vaccine virus or not. And some vaccine manufacturers may actually be prepared to pay for those tests in order to show that it was not their vaccine that caused the problem. So again, you know, I don't want to get too technical and too far down this line, but the bottom line is it would be very unlikely that a vaccine would cause all of the cats in a litter to be affected. So in that circumstance, it might well be worth investigating really just what exactly is going on. And it would involve just taking some swabs from their mouth or their eyes and getting them sent off for a very detailed genome analysis. So not every lab can do it, but some certainly can.
Yeah. And worth always checking, of course, before you make decisions for the vaccine manufacturers where they want to go with it as well.
Absolutely, and it's really important. Again, I touched on the SARSS, Suspected Adverse Reaction Surveillance System. It's really important that any adverse reactions are reported back to the drug manufacturer, the pharmaceutical manufacturer. They want to know, and they have a legal obligation to record and investigate any suspected adverse response, and that includes lack of effect. So it's not just things that cause side effects, it's where a drug or a vaccine doesn't do the thing it should do. So the vaccine manufacturers want to know about this stuff, and they do want to follow up on it. So they generally are very supportive of vets, and therefore by extension of owners who find themselves in this unfortunate situation.
Excellent. Martha, we've got so many comments coming
Oh.
through thanking you
Oh,
and
okay.
saying how fantastic the presentation was. And there's, again, a whole lot of questions. I'm just going to give one last one, and I hope I'm not opening too much of a can of worms.
Go
And
on.
feel
Fire
free
away.
to abbreviate your answer. But there have been a whole lot of questions related to do you or don't you vaccinate FELV, FIV, or corona positive cats?
Okay, so coronavirus positive cats, absolutely yes. If they are actually sick with FIP, you don't vaccinate sick cats, essentially. Whatever's making them sick, you don't vaccinate them. But the vast majority of cats with coronavirus are completely healthy.
Yep.
Likewise, FIV, the vast majority of cats with FIV are in the healthy status. So it's a bit like people with human immunodeficiency virus, HIV. You can be HIV positive but completely healthy, or very sadly, you can, it's rare these days, but you can be in the so-called AIDS scenario when you are unwell. Same with FIV cats. So yes, we would vaccinate a cat that is in a healthy carrier state with FIV. We would not vaccinate them when they're sick. Again, it is actually, this is one of the very few instances where it is recommended to give a killed vaccine if possible. Although personally, I have some argument with that, but if we stick with the guidelines do suggest using a killed vaccine for cats with FIV. Cats with FELV, again, So rarely do we see them these days that it hardly ever applies. But if they are unwell, we would not vaccinate. If they are healthy, we would.
Fabulous. Martha, this is why you are just the
Uh,
best to listen to. You make it all logical and easy to understand. Folks, I'm really, really sorry. If you're anything like me, I could sit here until tomorrow listening to Martha, but she needs to go. We need to go. We need to limit the time because we have run over. But Martha, it is with extreme and deep gratitude and thanks that I say to you, thank you for your time, and we will have you back anytime.
Excellent. Well, no, not at all. And thank you everyone for listening. And as I say, I hope it's been of interest and helpful.
Oh, it sure has. Folks, from my side, Bruce Stevenson, thank you for attending tonight and hanging on even though we've run late. We will see you on another webinar. Once again, Martha, thank you. Feline Friends Academy, thank you for your sponsorship. And it's good night from me.
Yeah. Good night, folks.